So good morning, Mary.
Good morning,
This is John Dombrowski with the Washington Pain Center. Now, you've been at a patient's practice you moved up from South Carolina, and you've been with us for how long? What's your guess?
2 months.
2 months,
2
okay.
months.
And you came in for what's going on?
My back was severely bothering me to the extent that I was just laying around on bed, on a sofa, laying flat. I was taking a lot of pain medicine, but it wasn't doing anything for
Okay.
it. I'd already had 2 steroid injections. The first one worked well, and they said, if you really want to get it, get a second one. I got the second one the same day that I moved literally up here. And I don't know if it was because we moved, but it didn't take. So the following week I called you and I made an appointment with Dr. Dombrowski. My daughter had found you, I don't know, as one of the best, as the
Okay,
best.
well, thank you.
Yeah.
But so we cared for you, and how was your experience? What was this overall? So if someone's watching us from a patient perspective with your scenario, what would you tell them?
If the steroid injection doesn't work for you, which it didn't for me 3 times, and he tried it here, try the ablation. One neurological anesthesiologist had told me that if I got the ablation, it might hurt the nerves that innervate the muscles that help me walk, and so I was scared of it. But you told me no, it's the nerve right beside that does not innervate anything, and you went after that nerve, and it was quite painful for a few seconds.
Okay.
You held me, you told me, you counted down, you said it's going to start easing. You made it extremely tolerable, mostly tolerable. But afterwards, the next day or two, I would say I started feeling 100% relief.
Wow.
Yeah, to the point where I'm taking 1 pain medicine for my back 3 times a day, and I'm able to work out and be happy.
So if people were to think about the radiofrequency ablation or other things, what would you tell them to do, advice-wise?
I'd say, come talk to you. Come
Okay.
talk to you. You know what you're doing. It was sort of like acupuncture.
Right.
In the way you tap, it felt like that's the way you sort of tapped in. But then when you hit the nerve, it was like you were scratching something that needed to be scratched, and then all of a sudden, yow!
Oh no.
Boom! And you were right there. 5, 4, 3, 2. It's going to ease off now, and it did. And yeah.
So right now, as we're speaking, you're on very little meds. You're more active.
Yes.
And you don't need an injection.
No.
You're doing great.
Doing great.
All right. Well, thanks for the time.
Thank you, sir. Thank you for your expertise.
No worries.